What is the most common dinosaur in dentistry? Well, over 80% of offices still use paper clips and old paper forms. It's time to bury that dinosaur and move to Opera DDS Forms, where for as little as $59 a month, you can get all of your forms online. We've got a slick form editor where you can create your own forms. There's just absolutely no reason to stick with the old school ways. Avoid all the half solutions with PDFs online. Get yourself true paperless forms, any form, any device, anywhere, starting at just $59 a month. Go to forms.operadds.com. Welcome to the Operatory Podcast, the podcast about burying dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is my man David Pryor, providing the patient perspective. How are you today, sir?
Yo, Bryan, how's it going?
I'm doing great. Even got a yo out of you, man. That's awesome.
Well, sometimes I've got to spice things up.
In an email the other day, about another dentist, I said they were OG CEREC doctor, and the responses I got about the OG thing, it's just just trying to lighten it up a little bit, right?
Did they not know what OG meant?
No, the problem is they probably did know what it meant. Yeah, no. Well, today, my man, I want to talk about the number one thing that will drive patients wild.
All right,
okay.
Let's hear it. As a patient, I'm very excited to be excited about this.
So, and it's I've been a dentist for 20 years now, over 20 years, and I've got the scars and lack of hair to prove it. Yep. But there's a lot of I've gone down lots of wrong paths in my career.
Yes,
right, and I've gone down lots of paths, and so, but when you're working on patients very intently for a very long time, and you've tried everything, what I've realized is that it is not something. Let's start off what it's not.
Okay.
Because there's a lot of people out there saying, "Ooh, you got to driving people, getting new patients," and there's lots of sizzle around with not a lot of substance to when people are talking about patients, right? Getting new patients and exceeding people's expectations is really where it's at, right? But it's not about your facility. Does that make sense?
Yep.
I think that.
Okay, so we're talking about getting new patients.
We're talking about basically getting patients to refer other patients to you.
Okay.
Have a good experience. Having your patients help build your practice for you.
Gotcha.
'Cause that's really what it's about.
Yep.
Right. And from the patient's perspective, right? That's really what we're talking about, is that there's a lot of things on our end that dentists feel and consultants will sell and marketers will sell dentists on how to get new patients, how to grow your practice.
Yep.
Okay, so a little more clarity.
Yep.
Sorry,
yep.
Right?
Yep.
And for example, let's talk about what it's not. Right?
Okay.
It's not your facility.
Right.
I've seen thriving practices that look like they're clean.
Yeah.
But they're not beautiful, right?
Right.
They just look like for example, Walmart Health we talked about.
Yeah.
Just is opening up.
Yep.
Doesn't look that great.
Right.
It's like a big barren room, right? But it's clean, right? Another bit. Well, so it's not your facility. Now, what I would say is it could be your facility turning people off.
Yeah.
If it's dirty, if it's cluttered, right? If you don't have enough room for people to walk around or enough parking, that could turn people off. But no patient. This is my opinion. I should ask this as a question. I don't think that patients are saying, "Oh, you got to see my dentist because, you know what, his reception area is fantastic."
It would be an amazing reception area. I've never seen that reception area, and I've been into a lot of reception areas.
And the second time you go, you wouldn't even care, right?
Right.
It's
if you did it crazy good, yeah.
Well, it's not like, okay, if you had the Bellagio entrance as your reception area, right? But then what are people going to think?
If I had an arcade as my reception area, I might talk about that.
Okay, well then there's plenty of pedodontists that probably have that for you, my man.
Well, guess where I'll be.
Darn, I just lost a patient. But it's not your facility, right?
Right, yeah.
Ultimately speaking, like really just keep it clean, keep it uncluttered. Don't spend your money on some gigantic water fixture in your reception area. People don't care. Right?
Yep.
Good example, the water fixture. Like keep that in your mind, right? Like
Okay.
what in the reception? Maybe we should frame this all around kind of the reception area a
Right.
bit, right? Number one, the second thing I want to point out that it's not, which is a big one for dentists, okay, is your clinical quality.
Yeah. Okay.
Do you agree? And we've done a podcast about this before,
Yeah.
and we, and we, but I
so-
want to point it out again.
So here's the thing. I have the unique perception or vision of what goes on in a lot of dentists' office because every time I get onto a demo with a dentist, I take a look at their website, and invariably their website has a picture of their reception area.
Which, by the way, it's not your website either. People aren't going to you because of your website.
Right. Well, that's why they're going to start going to you. That like,
let's touch that next.
Let's go come back to that. But one of the things that I think that really gets overlooked is the website. And when they do look at the reception area, I'm like, I don't care.
You don't care,
right?
Right.
And what, like, sometimes I'll have the on hold music, and doctors will be talking about all the cool technology that they have for dentistry, and I'm like, I work in this space
You
to
sell
some degree,
technology
right,
to dentists,
right? And I'm like, I don't care about this, and so I'm sitting there kind of snickering as I'm listening to this.
By the way, I have that exact on hold message at my practice.
Yeah,
Right.
yeah.
We have the exact same one. Like talking about all the technology
Right.
we use, and
Right.
you're right. Everybody's listening, and they don't care.
Right, and every doctor's website says, here's where I went to school, and here's
Don't care.
all the extended education that I've had.
Don't care.
And here's the new technology that I have.
Don't care.
And so now I'll let you get back to your point.
No, but you're exactly right.
Right.
You're hitting my point exactly.
Yep.
We're going about it two different ways,
Yep.
but clinical quality, just like a reception area, people only care if it sucks,
Yep.
right?
Yep.
It can be good, and everybody will care, right? Nobody will care. And your website, I would also say, obviously if it sucks, they'll care.
Yep.
But if it's okay,
Yep.
they don't care.
Yep.
All people are doing when they're going to your website is doing two things. One, getting your contact information, and just checking you out. Checking to see, does it look like you're from 1986, right?
Yep.
That's it. If you look like you're from the year 2000, you're good.
Yeah.
Right? That's it.
Yeah.
Is there any red flags? That's what people are looking for with patients. When patients we're going over this fast, but like we did a whole nother podcast on clinical quality. If you disagree with me, listen to that one, because it's people. I know we have to strive for the best clinical quality we can, but ultimately, it's not what patients are looking for. There's one thing that people are looking for. So if it's not your facility, if it's not your quality, if it's not your website or your marketing, what is it that people are looking for?
Other than don't hurt me.
Well, that's part of it. It's how you make them feel.
Yeah.
Right? It's how do you make them feel?
Yeah.
Period. End of story. Right? And it's like the Maya Angelou quote that people will only remember how you make them feel. I just totally butchered that quote. I don't remember what the exact quote is, but I paraphrased it. I didn't butcher it. But ultimately it's really about the patient's experience, what your schedule's like, how quickly they can get in, how if you see them, if you see them in a timely fashion on time, when you start, when you finish, paperless forms that make it seamless throughout the day, doing same day treatment, single day crowns, virtual reality to make anxiety. Those are the things that make the difference.
Yes.
Right?
Yep.
And I went through that a lot fast.
Yep.
Right? But ultimately what I wanted to focus in on with this podcast was that when you're looking at investing in your practice, the ROI comes from changing how people feel in your practice and how they experience your care. Does that make sense?
From my perspective as a patient, I could not agree more. Like the value of the CEREC isn't that it's a cool $150,000 device. The value of the CEREC to me is that I get my crown same day. That is the value of CEREC to me.
Thank you.
And so, the value of a CT image is zero. I don't care.
You're right. Beautifully said. Now, you could care if there's an issue that you can see in 3D, or if it leads to you getting an implant placed in 20 minutes versus 2.5 hours. Right. So there's value there, but when we're talking with patients about it, when we're investing in technology, if you're looking for true ROI, it comes from exceeding people's expectations, which means how do they experience your care? How do you make them feel when they come into your practice and when they leave? And if you're looking at their website, how does that website make them feel? Right.
Yep.
That's it.
So do this as a healthcare professional. Always do this. This is from when I do anything sales. I always say this from the patient perspective. So what? I've got a CT scanner. So what? So what does that mean to me? I've got a CAD CAM, or I've got a CEREC system. So what does that mean to me? And if you're advertising, if you're marketing on the so what factor, rather than the fact that I've got a $150,000 piece of equipment, tell me, what is that going to do for me? What does that mean to me?
Exactly. And if you're going to invest in something, for example, in the reception area,
not
a waterfall.
No.
A coffee pot.
Yeah.
Right?
Yeah.
It's true. Having a coffee pot and water and snacks is worth way more than having something that makes you look cool.
Now, I would suggest maybe Mountain Dew in the front area, but...
Oh, man. Yeah. You had to bring it to... I was riding this high of the podcast, and you just made me crash right down, man.
Sorry.
Well, sometimes the patient perspective is a little brutal. Thank you, my friend.
Thank you, Bryan. Have a great one.
You too. I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.